So today we discuss lbbb, that is left bundle branch block. So it is of two types, complete and incomplete. Complete depends on QRS duration. If it is more than 120 millisecond, it is complete. If it is between 100 to 120 millisecond, it is incomplete. Now anatomically, when lbbb is there, we come to know there are two main parts are involved, that is left side of interventricular septum and left free wall. So there are three major components of ventricular activation which you have to see. That is first right septal activation. So right septal activation will lead to, in left sided lead like V5 V6, you will see a positive small R wave. In right sided lead, a negative deflection, that is Q, small q. Following which, then once the septal activation has happened, then there is a delayed and anomalous left septal activation, which will lead to, again you see the left sided lead, that is V5 V6 or 1 AVL, you will find large R wave, that is a positivity. So you will find this large R wave. Similarly, in the right side you will get a deep S wave. Now important is the notching. Notching shows there is a delay of superior region of interventricular septum depolarization. Last thing, when the free wall. So free wall is like an extension of the previous which we have read about the left septal activation. In this, the only thing is that R dash, which is the second positive deflection, will be more than R, and there will be deep S wave. So these are the three things which we need to see in the ECG. Then what is the LBB signifier? LBB presents always say underlying heart disease, acute myocardial infarction if it is new onset LBB, or it is indication of placing biventricular pacing, cardiac resynchronized therapy for the cardiomyopathy with heart failure with LBB. Now for this, the criteria is simple. The new criteria for pacing, you see QRS complex 140 millisecond, more than it is in man, 130 in female. Then presence of RS or QS morphology in V1 and V2. Now how will you know when you don't know previously patient is having LBB? A patient came up with the LBB, whether it is new onset or not. So their criteria is called Scar-Bosa criteria. So in Scar-Bosa criteria, there are three things. You see for concordant ST segment elevation more than 1 mm, or ST segment depression V1 to V3, or if there is a discordant ST segment elevation, it should be more than or equal to 5 mm, which shows acute myocardial infarction. Thank you.